Welcome everyone, I'm Péter Misnyovszki, and in the following 8 minutes I would like to share with you my PhD topic and the two projects that I'm working on. So I work for both the Center of Translational Medicine as a PhD student and at the Institute of Forensic and Insurance Medicine as a resident student in my 5th year. And the group I'm working with is my supervisors, Klára Törő, Boglárka Macsa, my most esteemed scientific methodology supervisor, Rita Nagy, and the statistician, Zoltán Sipos. Our vision we are working on is that we can reduce the number of violent death cases that include suicides and accidental death cases, murders, manslaughter, and so on. And we are willing to achieve this through the careful assessment of risk factors and with better understanding different identification methods. And to do that, we do systematic review and meta-analysis on the identification techniques. Those are being postmortem imaging techniques. I will introduce them in the next slide. And our second topic is a registry analysis in which we are looking for several risk factors among weather parameters. So my first topic, the meta-analysis we are working on, is the postmortem imaging techniques as a possible replacement of autopsy. And what are postmortem imaging techniques? There are two quite novel postmortem imaging techniques. One of them is postmortem computed tomography with or without angiography, and the other is the postmortem magnetic resonance imaging, which is called PMMR. So what happens in these imaging techniques? So the cadavers, the body of the cadavers is taken and put into the device, either CT or MR, and the records are evaluated by experts, and thus they find the lesions, and the cause of death is, if it's possible, it's declared by that. Unfortunately, as these techniques are quite novel, there is a lack of defined role of them in the forensic medicine practice. The use of them ranges from somewhere between 0 to 40%. In some cases it's not available at all, but in some centers in several well-developed countries, this is one of the preferred techniques. Why is this feasible? So why would we like to use these techniques? So in case of autopsies, there are a lot of cultural and religious differences arising. So whether we do alterations to the body or not, whether we can do that or not, the relatives are sometimes, unfortunately, opposing that. And through the use of these techniques, there is no or only very small limited alterations to the body. Right? So that can help us coping with these issues. So to find out whether these techniques can be used, we pose the hypothesis that the sensitivity of the postmortem magnetic resonance imaging and the PM-CTA, the postmortem computed tomography with angiography or without it, reaches the golden standard of the autopsy, which is used every day. And our population is all the deceased who underwent autopsy and at least one of the two modalities of the PMMR or the PM-CTA. The intervention group was the postmortem radiological imaging techniques. The comparator was, as I mentioned, autopsy, and the outcome is the diagnostic accuracy parameters like sensitivity, specificity, positive and negative predictive values. And through this research, we would like to update the existing modalities used in forensic practice and thus introduce PM-CTA and PMMR on a larger scale level. As it is a review and meta-analysis, we searched through 5 databases in early November, and we have 2 domains in our search key, the first being first containing the postmortem radiological techniques and the second containing the comparator. In the next slide, you can see the flowchart of our selection. From 4,700 recurs, we have gone down to 241 recurs through a vast duplicate removal and a very careful title and abstract selection. We are working on the full text selection as of right now. And apart from finding out the different lesions, we are also working on, as I mentioned, finding risk factors in case of violent death cases, in this topic, suicidal death cases. And the title for that I chose is Forecasting by Weather, Registry Analysis of Environmental Parameters Associated with Suicidal Death. Why is that important? Even though the numbers are getting better here in Hungary, at least, in the last year there were more than 1,500 people who committed suicide in our country, which is more than 4 people every day. There are a few available publications which are inconclusive, and also the ones that found some association are found associations which are scientifically significant but small. So our aim is to use our prospective registry and find whether there are any association with certain meteorological parameters such as temperature, wind speed, precipitation, or atmospheric pressure. Our population used in this registry analysis is the population of Budapest, Pest, and Nógrád counties. That is because all the suicide cases that happen in these places have their autopsy done in our department in the Institute of Forensic and the Insurance Medicine here in Semmelweis University. The exposure is a significant change in meteorological factors I mentioned before, and the outcome is the incidence of suicidal death cases. So, thus the hypothesis that the change in a meteorological factor, at least one, shows association with the incidence of suicidal death cases. How can we use that? So, should we find any kind of association, we can use the targeted ads in on-the-spot times and have suicide hotlines or medical psychiatric care availability, so human resources distributed in a right way. So, the registry we are using as a single center registry in our department of the Institute of our institute, the Institute of Forensic and Insurance Medicine. We have all the non-natural cases of the before-mentioned Budapest, Pest, and Nógrád counties, and some of the natural also, but we are not using them in this registry analysis. And we have around more than 2,500 cases average per year. And we have sustained variables from 1987. We have a lot of old cases also, but unfortunately, as medicine developed, the international nomenclature also changed. Thus, the described diseases are also changed. Thus, we have these date. And the most important variables are also mentioned in the bottom of the slide. So through those topics we are working on finding out a better understanding of violent death cases and to find whether we can have some risk factors found also. And my quote is, those who cannot remember the past are condemned to repeat it.
Thank you very much for your very nice presentation. 2 small questions regarding your first topic. Why don't you have the Cohen's-kappa for the abstract selection? And regarding the second topic, very interesting, how will you gather the data regarding the exposure? Like the wind, and do you already have it collected? Or?
So to answer my first question, my partner who is working on the selection is still working on it, unfortunately. So thus, we don't have the Cohen's-kappa right now. And to answer your second question, in Hungary we have a national Institute for Meteorology, and they connect all of this data which we require. And I myself have used that data table already in other.
Actually, I'm really curious. When you are doing a registry analysis, you also have to think about confounding factors. And what kind of confounding factors can you include in this study? For example, I don't know, because of the weather, as Fanny was asking, the agriculture was worse, or I don't know, the economic went not so good that year, or what confounding factors should we include actually in this study besides age and gender and probably type of suicide or any other factors?
So we have been thinking about it, and we are still developing the idea of this research, because even though we have very sustained variables from 1987, there was quite a huge change in the population in in the life of Central Hungarian people in the 89 to 91 period, historically, basically. So we might have to check for that whether those people can be also included, or the effect of the historical changes can be statistically excluded in the end. So that is one thing, obviously, the historical and cultural changes. And one thing we have not included in this yet is the very recent changes of COVID, because there are already existing articles on the connection of COVID with any kind of suicidal cases. Already still developing, but there are articles on that too.
So a very brief idea rather than a question. So there's this legend of the werewolf. So old people turn into werewolf when the moon is full. I don't think that is true, but there's this quite a large existing body of science, and look for some scientific evidence if the lunar phases can influence psychiatric disorders. And I would suggest that if you do such a trial, you involve the lunar phases into the factors when you look at the weather factors as well, because weather is influenced as well as maybe psychiatric health as well. It's just an idea.
It seems very spiritual, but eventually lunar phases has very high physical effect on the Earth, with the changing of tides and everything like that. So they might have a proper effect, which is because of the changes of several physically measurable parameters.
And yet there are lots of studies looking at reasons why this happens, and if you want your study to be cited, maybe that's another factor to add to it.
Thank you.
Yeah, if I can be very brief, I was told to be very brief. You see, there are lots of questions, because this is a topic when you are the only professional. So, therefore everybody has some kind of opinion on this, including me. Your previous slide before this, you don't have to go back, shows that there are differences between Colombia and Hungary. Now, go back to the next slide. Okay. And the next slide, okay, that shows that you actually collected data from Budapest, Pest, and Nógrád. Now, I was involved in some kind of strategic plans of Semmelweis University to deal with Nógrád. actually trying to work together, so therefore kind of research and development goes up over there too. But the difficulty is that while Budapest and Pest, these are the kind of highest income, and I don't know about life expectancy, but certainly the best kind of medical kind of facilities. By Nógrád, that's the lowest actually income, lowest life expectancy, and probably the lowest in a kind of supply for medical treatment possibilities and so. So this may give a bias in your study if you take this into one population, because that is just so strikingly different in Nógrád. Actually you can do, for this that you may say that you do sub, blah, 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 blah. But still, I mean, when you go for significance, I mean, this could be a trouble if you bring all this together.
So we can separate them into groups and can account for that also. So that is an interesting idea, and it was more or less mentioned that no-grad count is very different, and even the different parts of no-grad county is very different, because the ones that are closer to Pest County is almost the same as Pest County, and the other parts are not. So I will remember that, and we will take that into consideration. Thank you.